Well, thank you very much, and I am delighted to be here and feel very honored to be presenting with Dr. Reinhardt. If there's intellectual expertise here, it's only because your aura is shadowing me, so thank you very much. And I so enjoyed the introductory comments because I really think it demonstrated the real leadership that you all show in this very, very critical time in our country, in our economy, and in our healthcare system. So thank you most of all. As your past president said, that the applause really goes to you, so thank you for all you do. So I want to share with you a very quick tour of the landscape in terms of how people are thinking about healthcare, particularly ACA, how people are feeling about hospitals, and how people, and where this takes us in terms of reform in general. First of all, in terms of healthcare reform, the law continues to remain very divisive. Having said that, and people are also, because of the law, very divided about the future of healthcare. It's interesting, and I'll show you this data. One of the most important things to remember, however, is that many of the people that oppose ACA oppose it because they think it didn't go far enough, not because they think it went too far. And so you have a public basically divided on it, but in many cases, the people that are about a third to 40% of the opposition actually comes from people who would share much of our agenda. You also have a public that readily admits that they know almost nothing about the law. And you still have half of people who say they're not even clear that the law passed. Now, part of that lack of knowledge really feeds the opposition, because if you think about it, if there is a law on the horizon that you have serious reservations about, then if you don't think it's passed, you're going to fight like hell to beat it, right? But if you think it's passed, at least the way most Americans think, it's like, okay, well, let's take what works and improve upon it. Let's not repeal the whole thing. Let's not defund the whole thing. So this lack of knowledge about whether or not this bill is even passed, and then, of course, lack of knowledge about the individual provisions is a very, very, very key part of what needs to change as we implement ACA and if we look to garner support for healthcare reform. People also tend to know much more about the false accusations that have been made. They know much more about death panels than they do about what kinds of provisions, positive provisions, are in the bill. And many of the provisions are quite popular when people are told about them individually, even though they don't associate them yet with ACA. We still have in this country two Americas, insured America that does not vote, and insured America that does vote, and uninsured America that does not vote. And so we still, even in this economy, are in a situation where about 94% of all voters have health insurance, at least for themselves, if not their families. So that makes for two very, very different agendas between the people that, many of the people that you see every day and that you're servicing, and the voting public who elects or defeats politicians. Low-income America is still facing tremendous challenges in terms of health care, and I'll show you a little data on that, but you live that data, so I don't need to really show that data to you. More importantly, however, is in this economy there's been a very serious erosion, and that is when we first started talking about national health care reform, you had a majority of Americans who said they were willing to pay a little bit more to help the uninsured obtain coverage. Ironically, as people's concern and real experience with being uninsured has increased, when more and more people think that they are actually at risk for being uninsured, their willingness in this economy to pay more to help the uninsured has diminished. And we now have, in probably what I think is the most detrimental trend, a majority of people who say they are not willing to pay more to help uninsured America obtain health care coverage. Now, part of that is because of how deep-reaching this recession has been. People feel overwhelmingly that they have been impacted by this recession, and they feel that they're out of money. Also, people don't think the end is in sight. Economic experts aside, other than our next speaker, who truly is an expert, I don't know where economists come from. Voters think they come from Mars because they certainly can't live in the real world. Real America, 52% of real America thinks that we are not headed toward recovery, but actually headed toward a deeper depression. And 46% of real Americans worry that someone in their family may lose their job in the next year. So in that context, it's pretty understandable that people are pulling in and being much more zero-sum. In terms of individual provisions that help themselves, if people are completely unaware of those, people are also even more unaware of some of the kinds of system changes that can make a big difference. And people also, the language that we use to describe some of these system reforms couldn't be worse if we deliberately designed it that way. So most Americans have no idea what a medical home is, but they don't want to go to it. And they assume that if it is a home, it must be a nursing home. It can't be better than their home, which is underwater already. And they're positive they can't afford it, and they're not sure their doctor's going to be at home, so they don't want to go to a medical home. Accountability care organization, people assume that's an HMO. You may have seen the data today that came out. The two organizations that are least trusted in America today are Congress, God bless them, and HMOs. So if we deliberately chose to pick language to undermine ourselves, we really couldn't have done much better. Now, there is positive language, but of course, it's been very, very hard to get that language adopted, and maybe some of that can start changing here. People do place a fair amount of trust in hospitals. You're not the most trusted healthcare organization, but you're also not the least. People trust their own judgment better than the experts' judgment, although they are giving slightly increased acknowledgement to the experts. Their favorite expert, though, is their own doctor, and their second favorite expert is Consumer Reports. People also have a lot of contradictory information about hospitals. So many people tend to think that their community hospitals are pretty good, but they also believe that they're very nervous about hospital infection and hospital error rates. And of course, you get a steady drumbeat in popular culture that undermines trust in hospital. You probably saw the article within the last week in USA Today about how it's almost impossible to ensure that you won't have the wrong body part operated on when you go into a hospital, something that's extremely unnerving to people. And real people say, well, why can't I just duct tape myself assigned to whatever part's supposed to be operated on if they can't get it right? God bless America. Duct tape the solution for everything. And I come from Montana, so I'm not arguing with that. We use duct tape for everything. People believe strongly in prevention, and they also believe strongly in providing incentives for better behavior. They do not like the idea of being punished. So they like the idea of being rewarded if they do something good, but they don't want to be punished for eating that extra bag of potato chips. And I'm sure you saw the study that came out today that showed that, indeed there is good food and bad food. America had been trying to convince itself that really you don't have to listen to that stuff because one week they tell you an egg's good, the next week they tell you an egg's bad, so just ignore it and eat the potato chips. But now there are indeed more studies that show, yes, indeed, there are good foods and bad foods. But as we think seriously about what's going on and America's ability to deal with what's going on, first of all, high fat and sugar food, McDonald's is about the only thing that the average American can afford anymore. They can't afford a vacation, they can't afford their house payment, they can still afford McDonald's. Moreover, 3 months ago, we had the single biggest increase in food prices in 32 years. And it was led by a 50% increase on average across the country in organic vegetable prices, 50% increase. So that puts a real damper on changing your food, even if you had wanted to, which a lot of Americans readily admit they didn't really want to. People also, and by the way, as you're listening to this, you may feel, and since you're behaviorists, you'll know this, but I always tell my candidates, Americans feel very comfortable holding mutually contradictory views and usually deeply resent having it pointed out to them. So if we're looking for consistency in my presentation, you're not going to find it. Maybe in Dr. Reinhardt's presentation you'll find consistency, but not in mine. Medicare remains very, very important to Americans. A majority of Americans solidly reject any proposal to change Medicare or to convert it to a voucher system. That is particularly strong with seniors, also extremely strong. It's across the board, but also extremely strong with voters 55 plus who feel like they have no time to put anything alternative together. And people 55 plus are extremely concerned about losing their mediocre job that they don't love anyway and never being able to get one back that has as good a benefits or as good a job. So that pre-retirement age cohort really, really been severely impacted by this economy and very, very concerned that they will not be able to pick it up and make it up by the time they retire. Also, those 55-year-olds have all their kids coming back to live with them. 54% of Generation Y, the 18 to 29-year-olds in this recession, have been back home at least once because they can't make it on their own, much to their chagrin and much to their parents' chagrin. So that pre-retirement cohort has really devastated their savings and very, very concerned about holding on to what they have in terms of health care. And for women in that age group, healthcare is a very, very prized commodity. It's something that they feel that one of our focus group participants said, women, we stay in bad jobs and bad marriages to keep those healthcare benefits. So we won't examine that any further, but think about it. So that's a prized commodity that women are very nervous, that age cohort very, very nervous that they will have their costs increase and their quality decline in terms of insurance reform. And they're worried about being pushed into a longer line, having even less time with their doctor, or in general having a decline in quality because of health care reform. So if that's the general atmosphere in which we're operating in with a lot of challenges in it, let's look at some of the data. First of all, you see here voters divided on whether they're favorable or unfavorable toward the ACA. Notice, which is always one of our problems, the intensity is on the side of the unfavorable. And this is what always undermines our political system, right? Is who's got the intensity? Who's got the people that are going to really write their member of Congress? No one writes their member of Congress and says, thank you for passing ACA. Lots of people write their member of Congress and say, hey, are you trying to throw me into a death panel or what? This, which looks like America having cardiac arrest, is basically the ups and downs of health care reform. The red line is favorable, the blue unfavorable. You can see, though, for quite a period of time, all of this year, basically since implementation, people have been negative toward health care reform, although they're basically divided. Americans say overwhelmingly they don't understand health care reform, and there's been very little increase in knowledge around health care reform. Now, people lie all the time. 7% of Americans would say, I'm the President of the United States. The fact that you have a majority, God bless them, the fact that you have a majority of Americans who say, I can't even make this up, I don't know anything about this bill, really tells you that America is operating on very, very little information about ACA. Who do people assume it will help? Well, the top number is low-income Americans, the uninsured, people with pre-existing conditions. The bottom is you and your family. Huge drop-off in terms of who's going to be better off. That pyramid has to get inverted. Real America, voting America, has to see some positive changes for themselves. And part of the problem is that many of the early changes that are coming on board are insurance reforms. And people just say, well, why did you have to redesign the entire healthcare system? Why could you just tell these insurance companies you can do X, Y, and Z and let it go at that? Why did you have to interfere in the entire healthcare system? In terms of the effect on myself, the orange numbers are people that think it'll be worse. The blue numbers are people that think it will be better. People are divided on whether it will help them get insurance, but people think their costs are going up for sure. Now, in this economy, that is not a trivial attack. And remember, Insured America came to the table to get their costs down, and they're worried that their costs are going up. And then people, particularly women, who are worried about their quality of care going down. 80% of the healthcare decision makers in this country are women. 80% of the healthcare voters in this country are women. There may be many areas where women actually influence the decision of men, but this is the one area where men actually admit it. And so men in our focus groups say all the time, well, you know, my wife tells me what insurance we're going to get. My girlfriend hounded me to get insurance. My mom told me I had to do it. It's the women that are really going to drive this effort, and the women that have to be the targets in our messaging efforts. In terms of false statements, the first column is people that recognize it as false. The second is people who believe it's true. The government will make all of the decisions for end-of-life care. 40% say that's true. That undocumented immigrants will receive financial help to buy insurance. 41% say that's true. And that this is a new government-run insurance plan. 59% say that's true. Now, many of us, I think, in this room, were very supportive of the public option. But nevertheless, it's become kind of vilified, even though it doesn't exist, by the right. In terms of people's views, if you disaggregate them, so remember people were divided about insurance. This is a very important question to look at because if you'll notice, what should people do regarding ACA? 30% of the people say the law should be expanded. So a significant portion of the people who are against the law are against it because they don't think it went far enough. 21% think keep it as it is. 19% would repeal it and replace it. Only 19% would repeal it altogether. So people are cautious. And again, very directly correlated to whether or not you think it exists. If you think it exists, you want to improve it. If you think it doesn't exist, you want to make sure that it doesn't pass. Cutting off all funding, 63% of Americans oppose cutting off all funding for ACA. The individual provisions, very, very popular. The blue numbers say keep this provision. The orange numbers say repeal it. Tax credits for small businesses, reduce the donut hole, pre-existing conditions, financial help for low and moderate income Americans, increase the Medicare payroll tax on the wealthy, all of those popular provisions. The one provision that is not popular is individual mandate. People really dislike the individual mandate, in part because they're fearful. They're fearful they're going to be demanded to do something that they can't afford. They're not sure these policies are going to exist. And they believe that if it's good enough, people will come. Here are the views among the public, and then you see views among Democrats or Republicans. Notice both Democrats and Republicans like very much the small business tax credit and the donut hole, as well as the pre-existing conditions. Republicans tend not to like helping the low income. Democrats do like helping the low income. Notice the Democrats, though, that bottom number, even they are divided on the mandate. And they don't, poor Democrats, thank you. They have no idea what to answer because they think it's kind of like whether you answer right track, wrong track. I mean, I feel this way when I'm asked it on a polling question. Well, it's our track, so do I lie and say I think things are going well? Or do I say that I think things are on the wrong track? So a lot of Democrats think, well, this is our mandate. I guess I'm supposed to like it, but I don't really. So people have no idea. Poor Democrats have no idea what to say. When we tested rescission, people said, oh, you mean the recession? That's bad. So don't use rescission anymore, lifetime caps. Gradually close the Medicare donut hole, high-risk pools for people with pre-existing conditions, requiring insurers to give rebates, eliminating caps on lifetime benefits, extending dependent care coverage until 26. Although, interestingly, there's a big difference between college-educated America and non-college-educated America. College-educated America loves that their kids are on until 26. Blue-collar Americans say, 8 years and the kid couldn't get going? Are you kidding me? So a little division there. But in general, our bigger point is that people think overwhelmingly there's a lot in this plan that they wish had passed. Wouldn't it be nice if that plan had passed? And I think getting those provisions out, a very, very important piece of what we need to do here. So what's happening with low-income America and the uninsured. Needless to say, and I don't need to tell you that, you live this every day, you can see the enormous problems that low-income America and uninsured America is having paying their bills and getting health care. People, unfortunately, assume that the uninsured is dominated by the unemployed. They do not think that there are very many working Americans who are uninsured. A huge problem in terms of just the imagery of our uninsured. As I mentioned, probably the most depressing and serious data I will show you. This has been a significant erosion. We never had Americans wildly excited about paying for other people, but at the peak of desire for health care reform and before the recession started, we had 63 to 65% of Americans who say, yeah, I would be willing to pay more to help the uninsured. Now it's down to 54%. Only Democrats remain willing to pay more. Independents have moved over, and Republicans have solidified in their views. In terms of the healthcare system, if we go from the individual provisions to the systemic award, people are really not aware of them. Again, 7% think I'm President of the United States, so an equal number know about accountable care organizations. So basically, nobody knows about any of these provisions, and they don't tend to be very popular in terms of just the titles. Now, when you tell people what these are, for example, establishing a personal health team of healthcare professionals coordinated by your family doctor or primary care physician, people love it. 76% of Americans give it a positive rating. People like the idea of coordinating information technology as long as privacy is protected. 73% like that, and 72% like incentives for preventive care. Additional primary health care force. Now, you would think, at least in terms of as desperate as America is in terms of jobs, that we would have advertised more this expansion of primary care health force, which is wildly popular with the public. But the public overwhelmingly likes it, believes it will be effective in reducing costs and improving quality. No American has any idea this is happening. In fact, they think healthcare professionals are getting laid off because what's in the news? Teachers, police, and nurses getting laid off in their states because of state legislatures. Chronic disease management. There was a time when people had no idea what chronic disease was. Now people are very aware of it. 2/3 of Americans are aware of chronic disease, very positive about managing it. Incentives for doctors and hospitals to provide best practices in terms of prevention, and eliminating copays and deductibles for necessary chronic disease treatment. All very, very popular with the public. How do people feel about you then? Last piece. Well, hospitals, you can see we put the bar around the wrong one, but hospitals are right above labor unions, and you can see that 61% trust you, 20% strongly trust you, behind nurses and doctors and groups representing patients, but still pretty good ratings, honestly. Way ahead of drug companies, health insurance companies, and major corporations. People really dislike health insurance companies, and drug companies are pretty close behind it, and major corporations are not particularly popular either. People are divided on whether or not there are big differences or small differences among local hospitals, but most people tend to believe that local hospitals where they live are better in quality, at least somewhat better in quality, than big hospitals that they read about elsewhere. And of course, public hospitals, some people think of themselves as having local public hospitals, but many people think of public hospitals as being those big hospitals someplace else. And even when people think about public hospitals, they often store them under other names, like the Catholic Hospital or something like that. In terms of people's preference, do you prefer the hospital you've used for years or the higher rated hospital? Well, in 1996, people perceived overwhelmingly that they preferred the hospital they'd used for years. That has declined somewhat, and there has been a rise in expertise, although again, people still, by about 19 points, prefer the hospital that they've gone to rather than the one that's rated the highest by experts. People are also very, very cynical right now about experts. For example, we just tested for another work scientists, and scientists sadly are in very bad disrepute. People think that scientists are bought and lie now after the climate change. They did have one group of scientists that they liked, marine biologists, because they thought, well, think about it. If you're a biologist, you're never making a lot of money. You're not sitting in a lab with a white coat, and you're running around taking mud samples, and that's dirty work. You must not be doing it for the money. You must be doing it for the love. So experts in general in kind of disrepute. What do people have in terms of public concern about hospitals? And these are pretty high numbers, frankly. That someone and themselves or their family may be harmed by infection, that there will be a medical error, and that someone will be harmed by a surgical error. Now, 65% of Americans, gotta love them, 65% of Americans haven't even had surgery and aren't planning on having surgery, but 65% of Americans are concerned that someone in their family or themselves will be impacted by surgical error. Then, what would people do about it? They believe overwhelmingly that there ought to be reports of errors publicly and some kind of state rating about errors. But this kind of constant pop culture drumbeat about infection and errors has definitely increased people's concern about that and decreased the rating of hospitals. In terms of prevention, people overwhelmingly support prevention, and people are increasingly aware of how much spending is going to people with chronic diseases. People support, as I mentioned, overwhelmingly incentives for better behavior, but as you'll see in a moment, that's about 25% more than people than want to do penalties. Some of the things that people liked: banning smoking, making school lunches more affordable, packaging, labeling, discounts on your insurance if you have healthy living, although people think, how would you enforce that? People also aware of the interaction between genetics and tend to say, well, a lot of this is genetic and you can't control it, more so than probably is. Penalties, remember 74% of Americans supported incentives, but only 45% of Americans support penalties for unhealthy lifestyles. And finally, the debate over Medicare. Well, this has changed dramatically. As you'll remember, in the last election, 2010, the debate over Medicare was all about the $55 million behind ads that ACA had cut Medicare. And you saw, because of that, you saw a 21-point vote for Republicans among seniors, a doubling of the margin that had existed before. And you also had Republicans ranked as better than Democrats on Medicare and Social Security for the first time in history. Always before that, Democrats have had double-digit advantages. People believe overwhelmingly in the importance of both Medicare and also Medicaid. Interestingly, support for Medicaid is on the rise. And when you frame Medicaid as insurance that covers seniors and particularly nursing home care, children, and people with disabilities, it's overwhelmingly supported by people. Here you see the importance of Medicare by age, but you can see, look at those 50 to 64-year-olds who really feel like, I got to maintain this, I don't have any other choices here. Now, people are equally supportive of Social Security, but there's one big difference. People think that this crisis, so-called crisis in Social Security, is manufactured. They think if the politicians would just stop stealing the money, there'd be enough money there. People believe that Medicare is sincerely in trouble. They're worried about it being overextended. They don't really understand it. They don't understand why they had to give mom money for prescription drugs when she had Medicare Part D. They don't understand what's a supplemental policy. It seems to people like, okay, it's a good foundation, but it's a system with a lot of holes in it, and you have to keep buttressing it up. Having said that, though, across a number of polls, people would keep Medicare as it is, and people overwhelmingly oppose privatizing it, making it a voucher, giving people money and putting them on their own with the insurance company. In fact, it takes very little messaging to get the opposition to the Ryan plan or the Republican plan up to levels that would be almost core values. So it is a good time and a bad time. And you thought that the atmosphere in which you were dealing with was complicated. Try being a pollster once in a while. It is a very complex time with a lot of opportunities, but also a lot of challenges for the work that you do. And part of the work that you do has to be a recognition of you are a very powerful and important public messenger, particularly in your communities. And there is a lot of messaging that needs to be done on healthcare and healthcare reform. The good news is that voters are paying a lot of attention to this because they think there are changes in play, and they also think that we have to get some of our healthcare, like chronic diseases, like obesity, better under control. So there is an increasing awareness that we've got to do some things. You have a increasing audience, but if I can leave you with one last thing, watch your language and leave your acronyms at home. So thank you for all you do, and I turn over to my great colleague.